Dr. Morgentaler.
Dr. Brandon.
How are you today?
I'm great, thanks.
Good,
How about
good.
yourself?
Well, I'm pretty good, and I wanted to talk about seeing you in the New York Times recently, interviewed for an article on testosterone. That was pretty cool.
Always great to see your name in print.
Absolutely. The article was everything you need to know about testosterone therapy. It was in the New York Times on January 25th, and David Dodge was the author. So the author wanted to know why prescription rates are going up for testosterone.
Right. Very good question.
Yeah.
Yeah. So, it's just astonishing to me now, especially given how things were in the past, how much we're seeing basically ads for these different clinics now that are offering testosterone. They're all over social media. And yet we still have a problem within mainstream medicine where a lot of the doctors are reluctant to even consider testosterone therapy for men who really are suffering because they've got low levels of testosterone.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgentaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
Right. So you're saying that you see an increase in access to testosterone in non-traditional ways, like it's advertised over social media, and this isn't like necessarily more traditional medicine, but within traditional medicine, they're still not prescribing when it's indicated. Is that what you're saying?
Yeah, it's such a complicated thing for me because I hate to put it this way, but in some ways I've been like an advocate, not for testosterone therapy, like let's give it to everybody, but for recognition of the impact of having low levels of testosterone. We call testosterone deficiency. I'm advocating for greater awareness of that in the medical community, because a lot of the guys I see and you've heard this with your own clients. I know we've talked about it, where somebody goes to the doctor. They've got all the symptoms, which are now reasonably well known, and we can talk quickly about what those are. And they have low levels of testosterone, and the doctor says, you're all right. You don't need testosterone.
All the time. That happens
or the variation that you've complained to me about where, you got low normal testosterone. And nobody knows what to do with. Well,
they don't want to touch it.
General doctors, primary care doctors don't want to touch it.
Yeah.
They've been confused. It's kind of been considered almost like fringe medicine. And yet, so at the same time, we have this reluctance within the mainstream medical community to deal with this. And we have a rise in prescriptions, not because the average doctor is saying, oh, I get it, it's safe now, we have a lot of good studies, which we do, but because it's being advertised. And being advertised often by clinics that have a pure profit motive involved. And there's some evidence that too high a percentage of men are getting testosterone prescriptions without even having a testosterone level checked.
Oh, my.
So one of my quotes in there was something along the lines that men who are getting testosterone often don't need it, while men who really need it aren't getting it.
And so, I will hear from men's partners worries about them being on testosterone. And so that quote kind of reminds me of this. So what about the partners the women whose husbands are on testosterone and they're worried and they think, well, should my husband not be on it?
Right. There have been two, to put a name to what those fears are, there have been two within the medical community that people have worried about for a long time, that we now have as strong data as you're ever going to get from these large randomized controlled trials, that they're not true. One of them is prostate cancer, which basically has been around since 1941 as a alleged concern and somehow has persisted despite every single piece of evidence indicating it's wrong.
Well, you did the initial research to prove that it was wrong.
I did. Well, I did. And I've been working that for a long time. I don't mean working at like an angle, but that's been what a lot of my work has been on. And the second concern has been cardiovascular concerns, which arose out of the blue like 10, 12 years ago, and now is seen without merit too. And when I say seen without merit, it's not just my opinion, is that we now have large randomized controlled trials specifically designed to look at these issues, and they find no increase in cardiovascular risk, no increase in prostate cancer. So for those in the know who stay up with the data, those aren't real risks anymore. Mm-hmm. Mm-hmm. It's just something that people talked about, but at some point you have to go with what the evidence is. The evidence isn't there for that. So, so when people say, gee, I don't know about this testosterone, the other unspoken thing that makes people nervous, both physicians and public, maybe partners of men who are thinking about doing it or started, is there's this sense that the doctors that practice giving testosterone therapy, and I don't mean practice like they're trying to get better at it. It's like medical practice. What a weird term it is, right? Practice medicine. Well, why don't you just get good at it or something? That these clinics that promote this are often like on the outskirts of town, in less desirable neighborhoods, lower rent places. And they're often mixed in with sort of more questionable medical practices.
There are billboards, advertising.
Yeah.
I see that here.
Yeah. And now on social media, it's everywhere.
Yeah.
And so the irony is that a lot of, and they don't necessarily, I don't want to make this a blanket statement, because some of these folks it's fantastic that they're offering these services, even though I may not endorse everything else that they offer. But at least they're open to the idea that some men really do have low levels of testosterone. It's affecting their lives. And it's not just all about sex and making guys horny again. It's about that the men don't feel right. Mm-hmm. And so at least they're doing that. And so, but the problem is that it needs to be done right.
Yeah. And so how do you know if it's being done right?
So listen, there's a certain minimum stuff that needs to go on. The men need to get blood tests that show that they do have low levels of testosterone, and they need to be monitored with blood tests once they're on treatment to make sure the levels aren't too high and that there are these safety parameters that are being checked up on.
Well, how do you know if you really do have low testosterone? Because that seems to be more of an opinion than fact amongst.
So there's disagreement, and some people are more generous in who has it than others. The bottom line, and not to get into the weeds with it, but basically if a man either has low levels of total testosterone or low levels of free testosterone, then he's got symptoms that are consistent. And the most common symptoms are sexual, like low sex drive, poor erections, not waking up with erections. The non-sexual symptoms tend to be fatigue that isn't explained by everyday life. Like these guys really feel depleted. Mood can be depressed, or they're blue, or they're blah. Their body doesn't respond to exercise the way that it used to. Those are some of the key ones.
Which is really important, because what you're saying is this is so much bigger than sex.
Yeah,
this has so much to do.
Let me just finish. So if you've got those symptoms and you have a low level of testosterone, you've got the condition. Uh-huh. Yeah, and for total testosterone, the number that I think is reasonable is below 350 nanograms per deciliter. In the United States, groups tend to use a more restrictive number, less than 300, but the Europeans and international groups accept 350. I think that's the right number. Mm-hmm. And or free testosterone less than 100 picograms per mil.
Great. Okay, so that's really clear.
Yeah.
Now, the New York Times article said that chronic diseases and obesity drives low testosterone or reduces testosterone. Is that true?
Yeah, they say it's the biggest driver. And a lot of people say this, And there's some evidence that low levels of testosterone are associated in a majority of cases with some chronic disease. Obesity is the biggest one, and we do know that obesity drives down testosterone. I have a hesitation around that because people often lose subtlety. And so I remember I had a doctor who worked in one of my clinics, and he saw a patient and his levels of testosterone were low. He had classic symptoms, and the doctor didn't want to treat him. He says he's not obese. He doesn't have any chronic diseases. And the illogic in that is that even though the majority of men have that, it's not a requirement, right? So there are a fair number of people who don't have chronic illnesses, who are not obese, who do have low levels of testosterone. They're symptomatic from it. Those men deserve treatment just like somebody who may have obesity, diabetes, something else.
And it could be a younger man. It doesn't have to be
exactly right.
An older man.
Yeah, it can happen men in their 20s.
Yeah.
Although typically we see them in their 50s. But it happens at younger ages too.
And could we say that it's happening more frequently among younger men than it used to? Or is that
We
not?
certainly hear about it more.
Yeah.
One of the things that's complicated is that there's greater awareness of this condition now. That's true. The whole thing about testosterone, the whole reason we have it these days is not because doctors got smart about it. It's not. The rise in prescription happens because people don't want to feel lousy anymore. This is patient-driven. And it has been since the 1990s. The first groups that, so I did my work with this. I began in 1988. And without any agenda. I had done research in lizards as an undergraduate, where testosterone, I showed that putting little pellets of testosterone in the brain was enough to regulate the entire range of sexual behavior for male lizards.
Yes.
And I learned nothing about testosterone, almost nothing. In medical school, 6 years of residency, I came out and I started seeing men as a full-fledged urologist now on staff at one of Harvard's teaching hospital, Beth Israel Hospital at the time, later Beth Israel Deaconess Medical Center. And these guys had sexual symptoms. It was 10 years before Viagra would show up. We had no idea there would ever be a pill. And the guys were desperate. They'd say, "Doc, you got to have something. My wife's going to leave me." And I didn't really know anything about testosterone. I hadn't been taught about it, but it worked in the lizards. and so I tried it on a few men, telling them what I'd been trained, which is that this was a serious risk for prostate cancer. And the ones who were willing to go ahead with it said, "Doc, I'm willing to do anything. I'll sign whatever consent form you want." They were desperate and they responded beautifully. And by beautifully, what I mean is they didn't just, yes, they had improvement in their sexual symptoms, but they told me things I never expected about things in general getting better. They'd say, "I wake up in the morning, I'm excited about my day. I haven't felt that way in 15 years.
Yeah.
They'd say, "I have patience. I have small children. I sit on the floor with them. I used to come home at the end of the day and I would say to my wife, I can't do this anymore. You got to be with them." Right? And now I've got so much patience with them. Like it was a sea shift for them. And I said, "This is amazing, amazing." And the big bugaboo was the fear of prostate cancer.
Right.
And if for me to continue to treat these men, I had to monitor their prostates extremely carefully and share with them my concerns or what the concerns were. And for those who were willing to do it, they went ahead. And what became obvious really very quickly is that my men weren't getting prostate cancer the way they were supposed to.
Mm-hmm.
In retrospect, the reason there had been a near complete global prohibition against the use of testosterone for half a century.
Wow.
For half a century. And I was taught and believed that if a guy just got an extra whiff of testosterone for a week, couple of weeks, it was guaranteed he would get prostate cancer. Now, to say it today sounds so dumb.
Mm-hmm.
But we all believed it. We were the greatest minds I trained with told me that was true. And part of the reason I think that prohibition lasted for so long, and is still a concern today, by the way, but the prohibition was that it was such a powerful belief that nobody was treating a lot of men. And if somebody was treating a lot of men, they could have said, now hold on, I've got, 100 patients, 200 patients, they're not getting prostate cancer.
Yeah.
So the first kind of evidence around that came from me. And I didn't have it as an agenda item. I was just, the guys were having so much benefit, even though there was this major risk as I understood it to be at the time. I shared that with my patients. And if they were willing to shoulder that burden of risk with me, let's go ahead. But the benefits were incredible to these men. And so that's what propelled me. And along the way, I was monitoring their prostates very carefully, and everything that we reported publicly in journals and meeting abstracts and lectures was completely contradictory to the old prostate cancer thing.
Well, so this must be an exciting time for you as you see testosterone being more received. Now, we talked about not necessarily in the ways you are hoping, but at least where progress is being made. And that must feel great to have started this whole trend.
It's, thank you for saying that. And it does. And at the same time, I have a lot of mixed reactions about how testosterone is now being portrayed and how it appears everywhere on social media with all the ads. It makes me really uncomfortable because my challenge over the years has been to convince what I would call the mainstream medical community, if you can put scare quotes around that testosterone is safe, that the effects, the beneficial effects are real and proven by high quality scientific articles. And the resistance to it has been enormous.
Yeah.
The average primary care doctor doesn't know what to do when a guy says, can you check me for testosterone? They don't know what to do. Maybe they'll get the level. And what I hear all the time, and you must hear it in your practice too, with people that you've referred, is the guy comes back, says, yeah, I got my blood checked by my doctor. He told me my level was low, or even more troubling is low normal. But he doesn't think I deserve treatment, or he's not comfortable treating it.
No, they say, but he doesn't think I need treatment.
Right.
That's what they say.
Yeah. So on the one hand, you have guys who have all the symptoms. They've read about it. They're often more knowledgeable than their doctors about it. And then they're presenting it to their regular doctors who they trust, right? This is their source for all their other medications and treatments and advice and wisdom. And the doctors are saying, I don't think so. So they're stuck. A lot of them are stuck. And that's what we have on the one side. On the other side, we have doctors who maybe do other things besides testosterone that offer medications or treatments that are not so mainstream, who are offering testosterone to some men. They say, oh, this is good. You don't even need a blood test. I think you'll benefit from this.
Wow. And so how do you know if the doctor you choose is appropriately treating you?
Yeah. Well, there's two basic minimum requirements. Number one, you need a blood test that suggests you have low testosterone. Number two is you have to be followed for safety with blood tests. If you're not getting monitored, if you didn't have a blood test to start with, go somewhere else. This isn't the doctor for you.
Great.
Yeah.
So is there anything else you would want to say about this?
Yeah. So it's fantastic on the one hand that there's greater awareness, at least among the public, that what people often used to call male middle-aged malaise, not feeling right, that may be related to low levels of a hormone called testosterone. Let's call it testosterone deficiency, and that it can be treated and in very high rates with success. Men feel better. And the safety issues around prostate cancer and cardiovascular issues should now be resolved. They're not real. And so that's good. The scary part for me, though, is still seeing that there's a lot of this that is marketed as if it's, I don't know, like as if it's a vitamin. It's still a prescription medicine. It has to be monitored. It has real effects on the body. And so find yourself somebody that feels reputable to you. And if you're symptomatic or your partner's symptomatic, and go after it that way.
That's great advice.
Well, thank you so much.
Thank you, Dr. Morgentaler.
Dr. Brandon, what a pleasure, always. See you again?
Absolutely.
Thank you for listening to The Sex Doctors with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.
I've been